I am Dr. Pooja Pandit-Tripathi, founder of Arogya Physiotherapy. I am a physiotherapist and a women fitness expert. So today we are going to talk about a condition called periarthritis shoulder or adhesive capsulitis, or many people call it frozen shoulder. So generally at around November to February, we will see lot of patients of frozen shoulder, and they'll not be able to diagnose and they'll be suffering from pain. So what are the ways that we can diagnose periarthritis shoulder and how to self-mobilize your shoulder is what we will be talking about. So let me first tell you how our shoulder joint is. So we have a clavicular bone here, or collarbone you call it, and a humerus here, and the wing or a scapula here. So these three bones are joined together and they form a ball and socket joint, and it's joined by a capsule, a soft capsule. And when it becomes hard is when we call it adhesive capsulitis. So what will happen is, if something is moving so freely and somehow it becomes tight, it will not allow the movement. So the first thing which you will experience in adhesive capsulitis is your movement will be restricted. Now how you will come to know? The women will find it difficult to hook the bra, and the men generally find it difficult when they will be wearing shirt. This hand taking back will be a problem, or they will have problem while combing. This hand will go so freely and the other hand will not go. The pain will be mostly sometimes in the morning, but mostly in the night, especially while sleeping. So you'll get up from the sleep around 2 o'clock or 3 o'clock with the pain in a shoulder, which may radiate on your triceps or biceps. So the pain may radiate from here to here. These are the few symptoms of adhesive capsulitis or frozen shoulder. So once you start experiencing it, there are few exercises which, if done properly, can completely cure it. If it doesn't get cured, then you have to go to your regular physiotherapist, which will help in, they'll mobilize it and completely heal it. Okay, so few of the exercises. First is wall ladder exercise. So what we do is, my hand goes up and then I put slight pressure and I try to stretch it as much as possible and slowly come back. So you don't go further, you just put pressure. You will be doing it both ways, so it is sideways as well as facing it. So that's how you do it. Now counts, I think, as many as possible, especially in adhesive capsulitis. The things are so easy, the exercises are so easy that I would suggest you do it as much as possible. The second is how you have to imagine a wheel in front and you have to operate that wheel. So you imagine that you're holding a huge wheel and it is going round and round. So you do clockwise and then anti-clockwise, both front and side. So inside especially, this movement will be slightly problem, but don't stop it. What is important is, with pain you have to do these exercises, because generally for the other condition we say pain is a contraindication, but in frozen shoulder you have to do exercises with pain. Okay. The third exercise is, this is your unaffected hand and this is the hand which is affected. So you hold your affected hand and you try to take it as back as possible and stretch. Yeah. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 and relax. Again, go back and stretch. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 and relax. Now there are few self-mobilization technique which is very easy and very effective. So what you have to do is, you have to keep your hands like this and then take it out. In, out, in, out, in, out. You also have to stretch and mobilize by using a towel. I call it towel exercise only. So when you are taking bath, you can do this exercise, or I suggest throughout the day, if possible, do the exercise. So this is my affected hand and I hold it tightly here, and this hand is just not going back. So what I do is, I use the other hand and hold this tightly and try to pull it up. Yes. 1, 2, 3, and do it as many counts as possible. And once you are done with the counts, you hold it for some time so that the shoulder opens completely. Yeah. And that's how you do the towel exercise. Very important exercise in adhesive capsulitis is called pendular exercise. We move our shoulder like a pendulum. That's why it's called pendular exercise. Now for the pendular exercise, you have to hold on to some weight. Okay, so it can be a bottle. If you have dumbbells, you can use the dumbbells. You have to stand next to a place where you can support. So this is my unaffected hand, and I use my unaffected hand to support, and the other hand just flat holds the weight, and I move it like a pendulum. So this is the way I move it. So it's front and back and front and back, and then side and side and side and side. And that's how. And do it again as many counts as possible. What is important is, don't do this. Your hand has to move like a pendulum. That's why these exercises are called pendular exercise. Now these are the exercises which we can do while seeing television, while going from here to there, while just standing. Then there are some lying down specific exercises. So what we do is, while lying down, this is my affected hand. So I take it as much back as possible. So for example, your hand is coming till now. Then from the unaffected hand, you hold the hand and you try to push as much as possible. And bring it back, and again push as much as possible. Hold there for the count of 1, 2, 3, 4, 5. If you can hold till 10 also, it would be nice. And then bring it back. Again, take it back. Okay. The second, what you will do is, you will come from the side. So for example, inside, your hand is only going till here. Again, you will use your unaffected hand and you try to bring it as much as possible. How much ever it is coming. Then very, very important movement which goes first in adhesive capsulitis is external rotation. So you try, this is maybe a little heavier weight. You can use a lighter weight, or you can use no weight at all. I don't mind. Why I am using weight is because weight itself will try to push it down. That's the reason I am using the weight. So you take it back and then you take it down. So your hand is in 90 degree. You take it down. So you can see the shoulder is coming forward. When I do this, shoulder comes forward. When I do this, the shoulder goes the other way. Yeah. And this will make the capsule slightly loosen up. Every time you will do the exercise, you will definitely feel that you are slightly better. Yes, there will be pain during the exercise, but after exercise you will definitely feel better. What is very important is how regular you are doing these exercises. So that is internal and external rotation. Then the third and the last one is, so you hold your hand at the back of your head so that it doesn't come out due to pain, and your elbow will be slightly up. So with the other hand you try to push it as down as possible. So for me it is going because I am not suffering from adhesive capsulitis or frozen shoulder, but people who are suffering, it doesn't go so easily. So you have to put slight pressure, hold it there and then back, and then pressure, hold it there and back. Yeah. So these are the exercises for adhesive capsulitis. I hope you recover as soon as possible. As soon as your range of motion becomes proper, so you are able to move your hand freely from up to down and from the side, and it's going back also easily, is when you should start your strengthening. Now we will post another video for upper arm strengthening. Thank you so much.